So now coming to the causes of the ischemia. Now what are different causes that may lead to the ischemia? So main and important cause that may lead to the ischemia is the reduced lumen. So now we need to see which are those causes that leads to the reduction in the lumen size. So first and most commonest cause is the atherosclerosis, and majority of the burden of this heart disease is beared by this single cause, that is atherosclerosis. What is another thing that may lead to cause this reduction in lumen, that is the spasm. If there is a sudden spasm of this arterial wall, that may also leads to the reduction in the lumen and reduced amount of blood supply to the heart. Another cause is the emboli. If there are emboli are present in the distant part of the body, and if they get lodged from that site and if they come to the coronary arteries, then again that can be a major factor which may lead to the reduce the lumen, and that can affect the amount of blood supply to the part of the myocardium. So that three factors are very important as far as the reduction in the lumen is concerned. Now another important factor which may lead to the ischemia, that is increased oxygen demand. So what is the cause, what is the factor or what is the stimulus that may lead to the increased oxygen demand? So as we know, so hypertrophy of the heart, that is the cause when oxygen demand gets increased. So now what are the causes that may lead to the hypertrophy of the heart? So as we know, if there is a aortic stenosis or hypertension is there, so if that hypertension is not controlled with the help of medicine or timely lifestyle intervention, then that may again leads to the formation of or development of the hypertrophy, and in this condition there is oxygen demand is increased, and that may be the another cause where this ischemia can be experienced by the patients. Now another factor which may lead to the ischemia is the decreased oxygen carrying capacity. If the patient is having the severe anemia, then hemoglobin may not be able to carry because of reduced amount. The oxygen will not be carried to the myocardium, and that may lead to the ischemia. So severe anemia could be the another factor for the ischemia. So now what is the doctor's role here? So now doctor's role is that he should try to understand or to find out what is the exact cause of the ischemia. So now first and most important, he should focus his attention on the atherosclerosis. So now accordingly I will explain you in our next coming slide that what is his action need to be taken and need to be explained to the patient also to find out or to diagnose the case of atherosclerosis. Now also we should focus that and rule out the another causes like spasm, distant emboli, and some other causes like uncontrolled hypertension or aortic stenosis or hypertrophy, and other cause, important cause like severe anemia. Once we rule out all these cause, then only we can say that now patient is suffering from atherosclerosis, which is the most common cause of a coronary artery disease. Now coming to the next, we will focus on the atherosclerosis. Now to understand how to prevent the coronary heart disease, we must understand how it begins or what is the pathophysiology of this atherosclerosis, because precursor, which is the precursor to the coronary heart disease. As we all know that triglyceride and cholesterol gets deposited in the linings of the walls of this artery, and that process is called as the atherosclerosis. What are three possibilities after having this atherosclerosis? So first possibility is that it will narrow the artery. It means that there will be a reduction of blood supply, and that may cause symptoms or that may not cause the symptoms. Now what is the another possibility of this having this atherosclerosis? That is rupture of this plaque and clot formation. if this atherosclerotic plaque gets ruptured, and if there is formation of this clot is there, and if that clot gets lodged in a reduced lumen area, that is where this another plaque is present, or even if in an area where this plaque is not present, that emboli can lead to the complete stoppage of blood supply to the part of myocardium, and that may lead to the heart attack or myocardial infarction. Now, what is another third possibility of this atherosclerosis is that if that remains for a prolonged period of time, then that may cause, for that longer period of time, that part of myocardium will get a lesser amount of blood supply, and because of that longer duration, then there may develop the weakness in the heart muscles, and obviously it will affect on the pumping capacity of the heart, and it will cause inadequate pumping, and there may be beginning of the symptoms will be there, and there may be a chance that because of this increased amount of burden on the heart, there may be a change in a normal rhythm may be possible, and that we need to diagnose on ECG with the help of defects in the conducting system. So these are the three possibilities that can happen in cases of the atherosclerosis. Now in this picture we can clearly see that, so in a first part there is atherosclerosis with blood clot has been shown, where we can see that there is a atherosclerotic plaque is there, but that has not yet ruptured, but because if that gets ruptured, so again there is one red color spot is we have shown here, where we can clearly see that if that get ruptured, so we may get the blood clots also. In another picture what we are seeing it simple atherosclerosis without clot, only the lumen of the arterial wall is reduced, obviously there will be the reduced amount of blood supply to the myocardium. In a third picture what we are seeing here is the spasm of the artery, and there is no atherosclerotic plaque is there. So this spasm also can stop the blood supply to the part of myocardium completely. So all these different picture, what we can say, there may be a different possibilities of person having the ischemia in presence or in absence of the atherosclerosis. So what we should understand at this stage is that when a large area of myocardium becomes ischemic, there can be an impairment in the relaxation and contraction of the myocardium, and if the blood flow to the tissue is improved at this stage, then myocardial ischemia can be reversed. So now dear friends, now it's the time to think over and what is the doctor's role at this stage if a patient comes to my clinic with same kind of symptoms. So he may have or may not have the symptoms. So what is his job at this level? So he should interact with the patient and try to get or to find out whether he is suffering from the atherosclerosis or not. For that, what he can do is he can take a good history of the patient, good family history of the patient, examine him properly whether he is suffering from any hypertensive condition, and ask about if he is having some diabetic or if he is having some exertional dyspnea, if he is having some symptoms that are diagnostic towards the atherosclerotic, and even if he doesn't have any symptom, you can induce some sort of stress and just find out if there is any symptom related to the chest pain or dyspnea on exertion or any sort of fatigue is there. That is, cardiac output is equal to the stroke volume into the heart rate, and whenever there is a damage to this cardiac muscle is there because of any reason, what will happen, the amount of blood that is ejected by heart per minute, that is cardiac output, will get reduced. So if a patient is having some atherosclerotic symptoms or if he is a case of atherosclerosis, then what will happen at this stage? Obviously his cardiac output will get reduced, but he may not have the symptoms. but remember what we have learned in the last lecture, that is the compensatory mechanisms which are there, they take into action to increase this cardiac output and to manage the blood supply to the different parts of the body. So you should understand at this level that if you start some brisk exercise, so increasing exercise tolerance capacity is the single most management tool at this level. So if you advise the lifestyle modification to these two patients, that is ischemic heart disease patients and chronic heart failure patients, those who are suffering from grade 1 and grade 2 form of dyspnea on exertion or chest pain, that is NYHA classification, then this will be the beneficial thing for him to get cured from the atherosclerosis, because increasing exercise tolerance capacity at this level only will not or will avoid the further stimulation of the compensatory mechanisms which that has got the unfavorable effects on the body. So you must remember that you can manage the case of NYHA classification 1 and 2 at this level by just advising the brisk exercise. So now in further slides we will see that how this brisk exercise is important, but remember that you should able to diagnose it early, that is early diagnosis and the intervention of lifestyle modification is important at this level, that is IHD grade NYHA grade 1 and grade 2. So along with that, what you need to do is that if that patient is suffering from the hypertension, or if that patient is having some diabetes, or if that patient is having some another risk factor related to the kidney disease, so that you need to be taken care of with the help of the medicines. So you should start the medicines for the other risk factors. If he is having cholesterol level high, then you should start some drugs which reduces the cholesterol level. So all these factors should be taken care of with the help of medicine, but remember, don't forget to explain the importance of lifestyle modification at these two levels, that is NYHA 1 and NYHA 2, that is ischemic heart disease and chronic heart failure. Now we will try to understand what is the pathophysiology of this atherosclerosis. As we have seen that it is atherosclerosis is nothing but the deposition of this cholesterol in the arterial wall to form the plaque which reduces the lumen. So why this cholesterol is needed for our body? So cholesterol has very important function or role to play in our body in the synthesis and maintenance of the cell membrane. And another important thing or function that for which this cholesterol is needed, that is synthesis of our steroid hormone. Now remember that you need to imagine something at this level. So how many cells are there in our body? So if you will imagine, you will find there are billions of millions of cells are there in our body, and you can imagine another thing, that if for the formation of this cell or the cell membrane, how much amount of cholesterol is needed. So huge amount of cholesterol is needed by this cell membrane, and how this cholesterol is carried to form this cell membrane to the peripheral tissue. Obviously the blood or the blood vessel are the channels through which this cholesterol is transported from one side to the another side. So we should remember that this blood vessel and this blood is flooded with the amount of this cholesterol all the time, and who are the transporters of this cholesterol? So the lipoproteins, there are different types of lipoproteins like VLDL, LDL and HDL, which transport this cholesterol from the manufacturing side, that is liver, to the peripheral tissue for the synthesis of the cell membrane. So now what important thing we need to understand here is the metabolism, normal metabolism of this cholesterol formation, synthesis and transport. So there are three things involved in this understanding the normal metabolism of the cholesterol, that is liver, which is acting as a manufacturing site, blood vessel which is acting as a transport system, and the peripheral tissue which are the beneficiaries or which utilizes the cholesterol for the synthesis of the cell membrane. Now here in slide what we can see, the VLDL, that is very low density lipoproteins. These are full of triglycerides and they have a little amount of cholesterol. If we compare this VLDL with the LDL particles, then LDL particles have more number of cholesterol and less number of triglycerides. So this cholesterol is secreted or manufactured in the liver, and this cholesterol is then again transported to the peripheral tissue with the help of the lipoproteins like VLDL and LDL through these blood vessels. So what happens in the blood vessel? So lipase converts this triglyceride to free fatty acids. So lipase is the enzyme which helps or which convert this triglyceride level to the free fatty acid level, and this LDL carries cholesterol to the peripheral tissue, and these free fatty acids are used as a source of energy, and this cholesterol is used to form the cell membrane. So this is about the normal metabolism, but remember one important thing, that extrahepatic cells cannot metabolize this cholesterol. So what it suggests or what it implies, that cholesterol cannot be metabolized other than the extrahepatic tissue, means they again need to be carried back to the liver for their excretion, and this function is done with the help of the HDL. So HDL are the type of proteins which helps in carrying back this excess amount of the cholesterol back to the liver for their excretion. So we should understand here that if you are having high level of high density lipoprotein, that is HDL, then your excretion of this excess cholesterol will be easier and you will not having this excess amount of cholesterol. So obviously we need to try to increase this HDL amount to keep this HDL amount at higher level. So this is about the normal metabolism of the liver, which needs or which helps in synthesis, transport and utilization of cholesterol, and as well as removing excess cholesterol out of the body whenever necessary. So how this atherosclerosis process begins? So now for that we need to understand what are the abnormal mechanisms or abnormal metabolism systems that takes place if there is a excess amount of cholesterol. So from where this excess amount of cholesterol can come? So there are two major factors which can lead to the excess fat deposition. First is, if you are taking excess amount of fat through your diet, and if you are not utilizing or there is no expenditure of this amount of calories that you have taken through your diet, then this excess amount of cholesterol will start getting deposited in your normal and then into your abnormal sites. So that is one factor. And what is another important factor? If there is a insulin resistance is there, that we see commonly in cases of the diabetes. So if the insulin resistance is there, then there will be no inhibition of this lipolysis, and what will it results into? So more and more free fatty acids will get generated, and that will lead to more and more formation of the triglyceride and more formation of the cholesterol. So excess amount of fat intake, lack of exercise and having diabetes or insulin resistance are the three most important factors that may lead to excess amount of cholesterol formation in your body. So this is the beginning of your abnormal mechanism. So what happens after the excess amount of cholesterol is there in your liver? So as far as possible, this excess amount of cholesterol will taken away through the bile or removed out of the body with the help of this bile secretion, and the level of this excess cholesterol will try to reduce down. But if there is a excess demand is there, or if there is supply is more than the demand, then this excess amount of cholesterol will now leads to involved in a different kind of procedure, that is hydrolysis, and this hydrolysis of this excess amount of cholesterol will lead to the formation of what is called small dense LDL particle. And this small dense LDL particle has got a capacity which pierces the arterial lumen through the endothelial tissue, and they gets entered into your arterial wall. And what happens there, that this small dense LDL particle will get oxidized with the help of macrophages, and now what is formed is called as the modified LDL cells. So, these modified LDL cells are the precursors for the atherosclerosis. These modified LDL cells secretes the protein, that is which these proteins now attracts the monocytes from the blood, and these monocytes again becomes the macrophages, and they engulfs these LDL cells and form the foam cells. So, this foam cell formation is taken by pathologists as a hallmark of the diagnostic for the atherosclerosis. So, once there is a formation of foam cells is there, so they again secrete a kind of cytokines, and the adjacent molecules are formed, which again helps in growing this process of the atherosclerosis, and they become the stimulus for attraction of these monocytes from the blood into the arterial wall, and this process of atherosclerosis again continues, and what it leads into the formation of the plaque. So, before formation of this plaque, what happens, that is we need to understand. So, ultimately when this process begins, so first there will be the hardening or stiffening of the arterial wall is there. Once that hardening or stiffening of arterial wall is there, then next step will be distension of the arterial wall. So, at maximum level this arterial wall get distended, but after some extent this arterial wall will not able to get distend, and then what happens is this plaque will start encroaching into the lumen, and we call it as a percentage. We measure that in terms of percentage of blockages, that is 10% block, 15% block, or 50 or 100% block. So, you should instruct to your patient that he should take either a less amount of calories through his diet, or either he should start doing the brisk exercise, so that the amount of calories that burned per day will get increased, and there will not be any excess amount of deposition of this fat in the abnormal side. So, now here you can manage the case by simply giving the counseling to the patients, by advising him the cardiac diet, which is high fiber and low calorie diet, and also by stimulating him to get on to the brisk exercise every day and reduce his excess cholesterol burden, and you can reverse back these ischemic symptoms which he is having or presented to you in your clinic. So, again along with that, if he is suffering from hypertension or some other risk factors like diabetic or high cholesterol level, then you need to start on medication at the same time.